Schistosomiasis is an infection caused by trematodes, flukes. These schistosomes, also called blood flukes, are parasitic flatworms that belong to the genus Schistosoma. Parasites are creatures who live in or on another organism, host, and get their food from the host. This has a negative effect on the host. In the case of schistosomiasis, the flukes are found in snails and then are shed into the water. If your skin comes in contact with contaminated water, the parasites can move into you and live there for years. What are the symptoms of schistosomiasis? Many people have no symptoms of schistosomiasis. Early signs and symptoms, those that happen within days of being infected, may include itchiness and a skin rash. Later symptoms, those that develop within 30 to 60 days of being infected, may include 1. Fever, 2. Chills, 3. Cough, 4. Muscle aches and pain. If you aren't treated, symptoms that develop after years of being infected may include 1. Pain in your stomach, 2. Enlarged liver, hepatomegaly, 3. Blood in your urine, P, also called hematuria, 4. Difficulty or pain while urinating, dysuria, 5. Blood in feces, poop, also called hematochezia, 6. Miscarriage. Chronic, long-lasting schistosomiasis may make it more likely that you'll develop scars on your liver or bladder cancer. In rare cases, you might have eggs in your brain or spinal cord. If this is true, you may have seizures, become paralyzed or have an inflamed spinal cord. What causes the condition? Schistosomiasis is caused by a parasite that resides in certain snails in freshwater locations. The form of the parasite that leaves the snail penetrates human skin with its forked head. Infected people release urine and feces that are infected with eggs into water where the snails are. The eggs move into the snails and the cycle goes on. Infected children and adults get infected over and over again. However, people don't infect each other. You can't give schistosomiasis to another person if you have it. Researchers are working to find a way to control the disease, with some efforts directed toward vaccine development and others toward finding a way to deal with the snails. Diagnosis and tests. How is schistosomiasis diagnosed? Sometimes eggs can be found in urine or stool samples, but often a blood test is needed. All of these are examined under a microscope. Management and treatment. What medications, treatments are used? Schistosomiasis is treated with the prescription medication praziquantel, bilharziasis. The drug, provided in pill form, belongs to a class of medications called anthelmintics. These types of drugs kill worms. You should take praziquantel with water and food. It's usually taken for 1 day, either as a single larger dose, or 3 smaller doses in 1 day. Before taking any medication, you should tell your healthcare provider what other medications and supplements you take and what kinds of allergies you have. You should also ask whether or not you'll be able to eat grapefruit or drink grapefruit juice while taking this medication. Complications, side effects of the treatment. You may have side effects from the infection itself, or from the medication and the worms dying off, or both. These might include 1. Headache, 2. Fever, 3. Stomach pain or nausea, 4. Dizziness, 5. Itching, 6. Malaise, just not feeling well. If you have hives, contact your healthcare provider. Also, call your provider about any other symptoms that worry you or that seem to be getting worse. Prevention. How can I reduce my risk? There are things you shouldn't do in water from fresh pools or lakes or rivers in areas that are known to have the snails and parasites that cause schistosomiasis. 1. Don't assume that the water is safe just because people tell you it's okay. 1. It's better to not take the chance in areas where the parasite is known to exist. 2. Don't drink from these bodies of water. 2. It's not that you'll get the parasites from drinking the water, but they can enter your skin around your mouth. 3. Don't bathe or swim in these waters. 4. Don't wash clothes in these waters. 5. Don't fish in these bodies of water. If you do get wet, you can use a towel to dry yourself off with vigorous motions. That may help, but you shouldn't rely on it.